Welcome to this Bowen Insurance Group educational video, specifically covering the parts of Medicare. In this video, we will list each part of Medicare, recognize the services that each part entails, and state the penalties associated with late enrollment. Medicare is a federal health insurance program, primarily for individuals aged 65 and older. Medicare is also available for people under 65 if they have disabilities or certain medical conditions. Medicare is divided into 4 parts: A, B, C, and D. Each part covers different healthcare services, so let's go through them one by one. First, we have Medicare Part A, which is also called hospital insurance. It helps cover costs if you need to be hospitalized, have skilled nursing care, hospice care, or some home health services. Part A has a deductible that is tied to benefit periods. This deductible can be charged multiple times throughout the year. Most people get Part A for free if they or their spouse worked and paid taxes to Medicare for at least 10 years. But if you don't qualify for premium-free Part A, you may have to pay a monthly premium. Next, we have Medicare Part B, which covers your everyday medical needs. Things like doctor visits, outpatient care, preventive services, and durable medical equipment. Unlike Part A, everyone pays a monthly premium for Part B, though costs can vary based on your income. Part B covers 80% of your medical costs, leaving you with a 20% copay. Part B also has an annual deductible that is paid at the beginning of each calendar year. If you don't sign up when you're first eligible, and you don't have other credible coverage like employer insurance, you'll pay a lifetime penalty. Your monthly premium increases by 10% for every full 12-month period you delayed enrollment. For example, if you wait 3 years, your premium will be 30% higher for life. Now let's talk about Medicare Part C, also known as Medicare Advantage. This is an alternative way to get your Medicare benefits through private insurance companies that are approved by Medicare. Part C covers everything that was covered under Parts A and B. Most Medicare Advantage plans include prescription drug coverage. They also include additional benefits like dental, vision, and hearing. Some offer fitness programs or transportation services. Medicare Advantage plans often have lower out-of-pocket costs than original Medicare, but they come with network restrictions, meaning that you need to use doctors and hospitals that are in your plan's network. There's no penalty for not choosing a Medicare Advantage plan, but you can only enroll during specific times, like the annual enrollment period, which runs every year between October 15th and December 7th. Last but not least, we have Medicare Part D, which helps cover the cost of prescription drugs. These plans are offered by private insurance companies and can be added to original Medicare. Part D covers prescription medications, as well as vaccines that aren't covered by Part B. It also includes brand name and generic drugs. If you don't enroll in a Part D plan when you're first eligible, and you don't have other drug coverage, you'll pay a permanent penalty. The penalty is calculated as 1% of the national drug plan average for every month you go without coverage. Now that you understand Medicare's 4 parts and the potential penalties, here are some key takeaways to help you make the best decision. Enroll on time. Your initial enrollment period starts 3 months before your 65th birthday and ends 3 months after the month that you turn 65. If you're still working, check if your employer's insurance is considered credible coverage before delaying Medicare. Compare original Medicare and Medicare Advantage to see which one best fits your needs. Review your options every year during Medicare's open enrollment period, which again is October 15th through December 7th. Medicare is a big decision, but you don't have to navigate this alone. If you have questions, reach out to Bowen Insurance Group. We're here to help you make the best choice for your health and your budget.